can we trick biology? That's an interesting approach by lifestyle intervention to prevent mutation of cancer cells as we age. So this relates to my previous attempt at an answer on what we can do to change the natural history. I don't think we can trick biology. Biology has evolved over millions of years, and I think has seen all the tricks so far. We have to work with biology and maybe augment the antioxidant status, lycopenes, maybe augment some of the vitamin profiling, for instance, vitamin D during the winter. These are just suggestions. I don't think anybody particularly knows, but understanding the biology will give us interventions that might slow down the progression or indeed prevent the progression of normal cells transforming into abnormal cells that then transform into prostate cancer cells. And this is a really interesting area at present and getting a lot of attention, and it's called interception because we intercept the process of change, of transformation before cancers are formed. But obviously, if you're going to do that, the intervention has to be extremely well tolerated because you're not treating cancer, you're treating or preventing changes in the cells that precede the development of cancer. There's currently no way that we know to prevent cancer. There's quite a lot of data on a drug that we use quite commonly in benign prostatic hyperplasia or in prostatic enlargement, and that's called finasteride or dutasteride. And whenever that's been studied, we've seen a reduction in the proportion of prostate cancers being diagnosed in the men on finasteride or dutasteride. These are prostate shrinking drugs versus placebo. We and colleagues are looking at that again to see whether those drugs which are currently licensed for BPH might be thought about once again for prostate cancer prevention. There have been attempts to study this in a formal manner to see if we can prevent prostate cancers. But so far, and the results were actually probably, yes, we can, but so far, none of these drugs have been licensed for use as a prostate cancer preventative agent. But I think we might see quite a bit more on that in the future.